everyone, I'm naturopathic Dr. Emily Lipinski. I focus on thyroid health and healing in my clinical practice, and I do this because I have Hashimoto's thyroiditis myself. I'm now clinically in remission, meaning that my antibodies have been below the upper limit for about 5 years now. And I brought those antibodies back into balance naturally, and that's what I do with a lot of my patients and clients. I'm talking to you today about some of the physical signs and symptoms you will see on your face and hair if your thyroid's out of balance. And actually I see it both with when patients' antibodies are normal or not. But if the thyroid is out of whack, I see signs and symptoms in the face and hair. I'm not wearing any makeup today, so you can see my face clearly and my hair, which I washed 2 nights ago. I don't have any product in. And it's really important because my face, hair, and eyebrows looked a lot different when my thyroid was out of whack. So first and foremost is eyebrows. When my antibodies were high, my eyebrows were 2/3, like right about here. So this last piece on this side and on this side had basically gone. And you can see it's still not really thick, but it's definitely grown in. The other thing that I definitely suffered from when my thyroid was out of balance was dry skin, particularly on my forehead here, on my cheeks, and my nose. So I'm not wearing any moisturizer today. I put some on last night before bed, but you can see my skin is definitely supple. I don't have dry flaking skin anymore. Lips was another area that I had really dry skin on. My area here around the lips was not cracking, but I see that in some thyroid patients, especially if there's nutrient deficiencies. I had constant dry lips, which again, not wearing any lip gloss or lipstick, and I no longer have peeling lips. Also, my hair, I've always had a lot of hair, but I definitely had a lot more hair falling out when my thyroid is out of balance. So I'm just pulling at my hair right now, and I'm not pulling out any strands. And before, I would do this and I would get a handful of little hairs. Now, obviously, there's a caveat when you do have children, like I've had 2 years ago and 4 years ago. Many women experience a little bit of hair loss during that time, which is normal. But I'm talking not just around childbirth. In general, I was losing a lot of hair. And finally was acne. So there's a myriad of reasons on why someone has acne, but I also see this with Hashimoto's, especially if there's gut issues, which often there are because autoimmune disease, which Hashimoto's is an autoimmune disease, can stem from the gut. So I had acne a lot around my mouth, and again, not really any acne. If you have any questions about what I'm talking about, reach out to me on Instagram, TikTok. My website is emilylipinski.com. If you are suffering from these symptoms, definitely talk to your healthcare provider about checking your thyroid and checking your antibodies to your thyroid.